what is maintenance treatment for melasma? So once your melasma is clear, how do you keep it clear? Now, I always talk about melasma as being a chronic skin disease. And when something's a chronic skin disease, once you clear it or you get yourself into remission from it, you need to maintain that clearance. There's lots of different ways to do maintenance, but actually, if we're going to look at the evidence base, there are some studies that have actually looked at this. So a suggested maintenance regime comprises using hydroquinone 4%, tretinoin 0.05%, and a little smidge of steroid applied twice weekly for 12 weeks. There was a randomized controlled trial of this done in 242 subjects that found that after melasma had resolved, using this maintenance therapy over 6 months on a tapering regime also helped to prevent relapse in most of the patients, over 50% of the patients. So they either did it twice weekly for 12 weeks, or then over 6 months, they did it 3 times weekly for the first month, twice weekly for the second month, and once weekly for the fourth month. So that's one way to do it. In another study, 70 patients with melasma were given the triple combination cream for 24 weeks continuously. And it was found that this was safe for moderate to severe melasma for up to 24 weeks when used continuously. And the only adverse events included redness, scaling of the skin, a bit of burning sensation as well. So, and there's a very low risk of skin atrophy. Now, one reason why I don't go down to this like tapering route, and I don't really do that with patients, is because most of my patients like to use tretinoin regularly because of the anti-aging effects, the effects on fine lines, on skin texture, on overall skin glow. They want to continue using tretinoin. So that's why I generally reduce the hydroquinone down to 2% or less, or even 1%, and then keep them on a good whack of tretinoin to keep those kind of anti-aging effects there. So there's lots of ways to do maintenance treatment. It really is patient dependent, and for every patient it's different. Some patients need slightly more hydroquinone, some patients don't need it at all, and it really depends on the patient. So, but it's reassuring to know that lots of people have already studied this to find out how they can do it or how we can do it, because I do like to practice evidence-based medicine, but I also need to combine the evidence with what my own clinical experience is and what works for my patients.